So melanoma is a very serious skin cancer. It's not the most common type of skin cancer, but the most serious. And it can happen at any age. It can happen even in young folks. In fact, it's one of the most common killers, cancer killers in young people, so it can happen at any age. When we think of melanoma, we often think of brown or black, but not always the case. Very rarely can sometimes be skin colored or pink. So it's important to, check your moles over about once a month, make sure no moles are changing. I don't like people to get too many new moles after age 30. So new mole after age 30 is something to go to a dermatologist about. So if we can catch it early, then your prognosis is very excellent. But after 1 millimeter of depth of the melanoma, then it's more likely to spread to lymph nodes and then to other parts of your body, and that's when it's deadly. Different types of melanoma. There's one that's called a nodular melanoma, and that is more raised, kind of more round, and those tend to grow very fast. So those can be pretty serious and deadly pretty fast. Thankfully, they're not the most common type of melanoma. The most common type is what we call the superficial spreading, where they initially start kind of flat and spread out flat, and then eventually we'll get a lump. But that can take some time, so we're able to catch it hopefully before it gets that lump. So we live at a very high elevation here, which makes the sun more intense. So that puts you at a greater risk for melanoma because you can burn easier. In fact, Oregon has the 6th highest rate of melanoma in the country, and our county in particular is one of the highest rates of melanoma. Because we love the outdoors here, we're always in the sun. Sometimes we aren't the best with wearing our sunscreen, so I think that puts us at risk. There isn't actually a set guideline on when you should get a skin check. I always say if you're nervous about a mole, come on in. They do say maybe at age 50 you should come in for at least a baseline skin exam. Also, if you're very fair, red hair, freckly, you should probably come on in. Also, if you have a first-degree relative with a history of melanoma, that's another reason to come in. But like I said, if you're worried about anything, no matter what age you are, you should come in because melanoma can happen even in children. If you're worried about something or you just want a check, I'll check you over, and then if I see anything suspicious, oftentimes I'll take photographs, and then I'd like to see you back in a year to make sure those moles haven't changed. And then if everything's looking good in a year, then maybe we can spread it out. But like I said, if you're fair, or if you have a family history of melanoma, or if you have a history of other skin cancers like basal cell or squamous cell, it means you have a higher risk for melanoma, so you should be seen once a year if that's the case. So as we talked about, you want to try to get to know your moles, make sure they're not changing, and you say, well, what do I look for? You look for the A, B, C, D, E's of melanoma. So A stands for asymmetry, meaning if you draw a line down the middle of your mole, it should look the same on either side of the line. B is borders. We like moles to have a nice round edge, not a jagged or scalloped border. C is color. In general, we like moles to be one color. D is diameter. We like them less than about 6 millimeters, which is the size of a pencil eraser. And then they just recently added on E for evolution, any mole that's itching, bleeding, growing, or changing. So the sooner you can come in when you notice something a little bit off on your moles, the better off you'll be. In fact, I've had people come in and say, hey doc, this mole just started itching, and I looked at it and it was small, one color. Took it off because the patient told me it was itching and it's been melanoma. So it can be life-saving to come in. You can actually even get melanoma in the back of your eye. So not all of it's related to how much sun you've had. Some of it's genetic and things like that. So it can happen anywhere. And that's why when you look at your body once a month, make sure you look between your toes and the bottom of your foot, because that's areas that we don't look at very often. And that's where they can be pretty advanced. In terms of sunscreen, I like at least an SPF 30 or even higher. And the problem with sunscreen is we never use enough of it. So you have to reapply every couple hours, or after you get out of swimming or out of the pool, you want to reapply. And I also like hats and sun shirts too, because we never use enough sunscreen, we don't reapply enough. So the hat, it's a physical barrier between you and the sun. And I also like rash guards, or shirts that are made out of swimsuit material. And you don't have to worry about reapplying sunscreen. If you get hot, you jump in, they hold in the moisture, keep you cool. Surfers wear them all the time. I like to wear it, especially if I'm out snorkeling or paddleboarding or kayaking, because then I'm protected without having to think about it.
And remember, it is recommended that you have no lower than an SPF of 30 anytime you are out in the sun, even if it's cloudy. We'll talk about some skincare products after this.